All right. Good afternoon, everyone. And thank you so much for joining us for this awesome event that's been a long time in the making, but I'm so excited to have this conversation. My name is LaTricea Adams, founder, CEO, and president of Black Millennials for Flint. And it is an honor to have partnership with Environment America, as well as the Children's Environmental Health Network, as we unpack the Get the Lead Out report, which will be a briefing around this recent report that we are honored to have one of the authors here with us this afternoon of this report that really digs into what's the current state of water in our public schools. So we'll hear in great depth from John with that report, and then we'll follow up with a short panel about what's next. So a little bit later in today's stream of events, we'll be introduced to some phenomenal panelists that'll have an opportunity to go a little bit in depth about who they are and their contributions and their continued work as it relates to really getting lead out of drinking water in our schools. So with that, I'm going to actually transition over to John. I want to make sure that you are able to share all of your phenomenal information, all of the deets that we need to know here on Zoom today, as well as on Facebook Live. So would you like for me to present your slides, or would you like to control them, John?
That would be great if you're able to do it.
All right.
Yeah.
And we already know the Zoom culture. If you're ready for me to go ahead and pass to the next slide, you can just say next slide. So I'll go ahead and get that set up for you.
Thanks so much.
Yeah, while I'm doing that, please feel free to do a bit of an introduction, provide a little bit more about you to our guest this afternoon.
Absolutely. Yeah. So my name is John Rumpler, and I'm the Clean Water Program Director for Environment America and our 501c3 organization, Environment America Research and Policy Center. We are a network of organizations. We've got affiliates in 30 states now. We're supported by thousands of individual grassroots members. And we work on campaigns to protect public health and the environment, including ensuring that kids have safe drinking water. I'm based here in Boston, but I work with our folks all across the country, and I'm honored that I get a chance to work with NSA regularly through the Clean Water for All Coalition. She's doing fantastic work there, and honored to be joined by her today. So that's a little bit about me and Environment America. We can now just go right over to the report and the campaign. I think that, like many of you, we were shocked and appalled to see what happened in Flint, where an entire community had its water highly contaminated with lead. It's not the only community by any means that has suffered this tragedy, but it was really high profile and outrageous, and I think was an alarm to the rest of the country of how big of a problem we have. And in the wake of that crisis, we launched our Get the Lead Out campaign. There are a lot of organizations that have been doing incredible work at the national level and the local level around lead service lines and making water safer at the residential level. But what we learned as we started looking into this issue is that there was no one that was really looking at lead where our kids go to learn and play every day, and that's our schools. Schools, 90% of schools aren't even directly regulated by the federal lead and copper rule. The federal standards, as inadequate as they are, they don't even apply. So if there aren't state and local safeguards, there is really nothing at all to stop lead contamination of water at schools, and in many places, child care centers as well. So that's how we launched our Get the Lead Out campaign, was to focus on the problem of lead contamination at schools and at child care centers, where there really isn't any adequate federal regulation. And also, of course, because we know that kids are most vulnerable to the impacts of lead, this potent neurotoxin that affects the way they grow, learn, and behave. Let's go to the next slide. So let's start with what we want before we dig into the problem that we're facing. I think we all know that our kids need safe water to drink every day. Water is vital for hydration and health. Our kids are being challenged to learn every day at school. They need to stay hydrated to be able to function, to be able to thrive, to be able to be healthy physically and otherwise, and do all of their activities. So that's really what we want, is safe drinking water. And I should say, by the way, not just for kids, right? We want safe drinking water for adults and everybody, but really the focus of this campaign in schools, we want safe drinking water for kids. On the next slide, however, we find that that is not, unfortunately, the case. In the wake of the Flint water crisis, more and more schools across the country started to test their water for lead. And while I'm going to get into the fact that that lead testing is inherently problematic in some ways, it does give us a pretty strong indication that there is a serious, widespread problem of lead. This map that you see here on the screen, we compiled all the publicly available lead testing data from schools across the country that we could find. Not all schools publish their data in full. Not all schools are even testing their water to begin with. But I think if you look at this map, what you'll see, and the link, by the way, is on the left-hand column where the text says lead contamination of schools' drinking water is widespread. If you click on that map, you can click on every single state and you'll see what data is available. If you just scroll down from that toolkit down a little bit further, there's the map. So we can just pick a state. Let's take Massachusetts, just because I happen to be here. Going up just a little bit. One more. There we go. Yeah. So at the time, over half of the taps tested found lead in the water just in Massachusetts. We found similar percentages in other states, either half the taps tested or half the schools tested across the state having lead in places as varied as Texas, Arizona, Massachusetts, Oregon, Washington, Alabama, et cetera, wherever the available data is, it's showing really pervasive lead contamination. So LaTricea, thanks for clicking through to that map. That's a great resource. So whatever state you're in, if you happen to be in Arizona or Illinois or Montana or New Jersey, you can click on our map and see what the data is that's currently available for your state. So that's a big problem. And if we go to the next slide, here's why. Because lead is highly toxic. It's a potent neurotoxin. It actually damages kids' brains. And that's just outrageous, whether we're talking about the way, ability to learn, or behavior patterns, or lost IQ points, or even loss of physical impacts on, kidneys and brain function and all kinds of other things. And the key here is that lead is toxic for kids even at very low levels. In our report, we review the medical and scientific literature showing kids having significant learning loss even at very low levels of lead. So that's why this is such an important problem for us to solve. Next slide. How did we get here? How did we get to the point that we have this toxic substance flowing through the water systems in our schools that our kids drink every day? And the answer is because, unfortunately, for decades, and not just in our schools, but in our schools, our childcare centers, our homes, all of our plumbing, we unfortunately made these materials with lead, enough lead to contaminate. I should note that for the most part, and I don't want to say there's never a case, but for the most part, there is not lead in the water coming from the water treatment plant. When it leaves the plant, they've already treated it for all kinds of toxic substances, removed those. including lead. By and large, again, I don't mean to say there's never been a water utility in violation, but that's not really where the problem is. The problem is when it flows through the pipes and the plumbing all the way to the faucets and fountains and comes out the tap. All of those places along the way in this schematic that we created shows where lead can get into the water. And the longer that lead sits in contact with water, the greater there is a chance of that corrosion happening. There's all kinds of other variables too. Temperature, pH, vibration, the age of the building, and so forth and so on. And the reason I emphasize this is not because any of us are going to become water chemists to understand these factors, but to know that lead contamination of water is highly variable. I can't stress that enough. It is highly variable. So you could test a faucet or a fountain one day and find no lead, the next day find no lead, the next day find no lead, and then boom, on Thursday, there's some lead in the water. This is why some of the most prominent water chemists and engineers out there, like Mark Edwards from Virginia Tech, has compared lead testing to Russian roulette. I don't think we should be playing Russian roulette with our kids' water. I think we should be preventing lead contamination everywhere. Let's go to the next slide. So how do we solve this problem? I guess I sort of just gave away the answer to my next question, but to the extent that school districts or states are doing anything in most places, what they're doing is what we would call test and fix. They are testing for the lead, and when they happen to get a test that confirms that our kids have been drinking lead in the water, they then fix that particular tap. Again, the problem with that approach is that lead testing, even when it is done properly, often any single sample will fail to detect the maximum amount of lead contamination. So, we're only fixing some of the problem if we're just responding to test results. And that problem is exacerbated even further if we're only fixing those places where lead exceeds a certain level, like 15 parts per billion, which is the so-called action level of EPA's lead and copper rule. Now, that action level was never set to be a place where it's measuring safe water for people, never mind kids in particular. It was just meant as a canary in the coal mine warning scheme to tell water utilities they had a systematic problem and needed to do something about it. And yet, unfortunately, many school officials and state legislators and other regulators have grabbed onto that 15 part per billion action level and used that in these test and fix schemes to limit the number of taps that they're actually doing anything to ensure safe water. The better course of action is to just assume that any faucet or fountain or other tap used for drinking or cooking in our schools and childcare centers is a likely source of lead contamination, and that we need to take preventive steps to get the lead out. So let's go to the next slide and see what those common sense measures are. First thing we should do is replace fountains with water stations that have filters. This is a real two-for in terms of its benefit. One is you're removing the fountains that are themselves a source of lead. Two is the filters that you're putting on then capture lead that could be coming from the plumbing, the pipes, et cetera, further back in the school system. And the third benefit that the pediatricians and children's health experts tell me is that kids are much more likely to drink more water when they can fill up a water bottle instead of just taking a couple of sips from a fountain. So putting in those water stations helps kids stay hydrated. We just want to make sure that those water stations actually have those filters, or we're missing a huge opportunity to ensure safer water. Second, we want to put filters on other taps that are used for cooking and drinking as well, not just replacing the fountains. If there are other places, like for example, a kitchen sink or a sink in the, cafeteria or the teacher's lounge or whatever, all of those places, we want to put filters on that are certified to remove lead. Next is we want to get to the root of the problem, right? The root of the problem is that there's actually lead in the water delivery system. So over time, we want to replace those lead-bearing parts, especially lead service lines. Now, I say lead service, you might have thought, well, why is lead service lines, why aren't you making that the first thing that you would have done, since we know from Flint and Newark and other places that lead service lines are like the #1 source of contamination in buildings that have them. The reason is there are not that many schools that have lead service lines. Lead service lines were typically made in 2 inches of diameter, which is too small to provide the volume of water that most of our larger schools need. So a rural schoolhouse somewhere, sure. A small child care center, sure. All of these may have lead service lines and those pipes should be removed immediately. But a large middle school or elementary school or high school with hundreds of kids in it, unlikely to have a lead service line. So it's a really important step, but I didn't put it first because we don't want most schools to think, oh, well, if we don't have a lead service line, we don't have a problem. No, most of the problem in most schools is with the plumbing, the faucets, the fountains inside the school. And the last thing we need to do is not use that 15 part per billion limit, or even a lower limit, but like 5 parts per billion, which is certainly a step in the right direction, but actually get as close to 0 as possible. The American Academy of Pediatrics, in their 2016 policy statement on lead toxicity to children, urged all schools to adopt a 1 part per billion limit on lead. Again, I think the idea there is to just get as close to 0 with an enforceable, measurable standard. And we now know that the technology is there to get down to 1 part per billion and to measure down to 1 part per billion. So the standard is feasible as well. Again, I want to emphasize that in our ideal world, those tests to see about 1 part per billion are after we've taken all these preventative steps at every tap, just to make sure that they're working properly, instead of being the trigger for taking action only at taps where lead is detected. Let's go to the next slide. So what did we do? We took our learning about how pervasive the problem is and what kinds of solutions will really ensure safe drinking water for our kids, and we graded the states on their policies, their laws, their regulations, and so forth around the issue of lead in schools' drinking water. This is the 3rd time we've done this report. The first time was 2017. Then we saw that a few more states had adopted some laws and policies. So we did it again in 2019. And now a number of states have at least taken some steps in the right direction since 2019. So we updated our report and graded all 50 states for the 2023 report we just released a month or 2 ago. So this is what it looks like. All of the states that are in gray are failing. The ones in the purplish color are Ds, so not so good. And then varying shades of blue for kind of the C- to the B- range, and you can see what those are. And then finally, Washington, D.C. comes out at the head of the pack. And the reason is simple, is that Washington, D.C. is the only jurisdiction in the country that takes a preventative approach of not just testing and remediating, but actually requiring filters on every outlet used for drinking and cooking. And impressively in DC, I know Michael is here and he can talk in greater detail, but I just want to give a shout out to the District of Columbia here, not only in schools, but also these filters are required at childcare centers, and also at public parks. So all of the places where our kids are going to go and learn and play and drink water, that first step of filters is a great step, and that's why DC is at the top of the pack. As the B+ grade implies, we think there's room for DC to do even more and do better, which I can talk about later, but suffice it to say, in what is that expression? In the land of the blind, the one-eyed man is king. DC is really setting the pace for other states to follow. We want to see states do even better. Let's go to the next slide and look under the hood as to how we did these grades. The first thing we did is we looked at the solutions. So our school districts, our states requiring prevention at every tap or just test and fix. And if they are saying, well, we're going to fix wherever we find lead, then what kinds of remediation are they using? Are they actually putting on filters and replacing lead-bearing parts? Or are they just flushing the water for a few minutes every couple of days and hoping that that does the trick, which we know it does not? Next thing we looked at is the lead limit. If you are going to have a test and fix scheme, then it's really important that the lead limit is as close to 0 as possible so that any detection of lead will trigger remediation. That's not the case in most places, but that's a factor we looked at. Testing protocols. This is one area where I think most places are getting better. But back, just 4 or 5 years ago, there were school districts that were using egregious testing protocols known to hide or mask the level of lead, further reducing, the real picture of how systemic the problem is. So we looked at that. Disclosure. Obviously, the most important thing is stop the contamination from happening, but there needs to be some accountability to the public. What did you find? What steps did you take? When was the last time that lead filter was replaced? And so forth and so on. Applicability simply refers to, does this law or policy apply to schools? Does it apply to all schools or just some schools? Does it apply to childcare in addition to schools? We gave points variable inherent in that. And then finally, there were a few places where we gave extra credit points, mostly related to lead service lines. Now, again, even though lead service lines are not prevalent in most schools, we know that kids also drink water at home. And so if you have a state like New Jersey that actually doesn't have a great standard or regulation around schools, but does have the strongest law in the nation requiring all lead service lines to be fully replaced in 10 years, we wanted to give New Jersey and places like that credit for that crucial step to ensure safer drinking water for kids beyond just schools. So we added that into our scheme. Some people might say we were more generous than we should have been, but we thought it was an important thing to give credit for. So that's how we graded the states. In case you were wondering, well, why is it that Utah got a C- and, New Hampshire got a B+ and so forth and so on? And if you dig into the report, there's a whole complicated chart with all of the points for every single one of these things for all 50 states. Then there's a paragraph narrative with links to all of the sources in the pack. If you really want to wonk out, trust me, it's all there and you can find it. But this is kind of the basic big picture of how we graded all of the states in DC. Let's go to the next slide. While there was a disappointing picture across the board with most states failing to do enough, some states just not doing anything at all, there are a few really good highlights. At the state level, I mentioned the New Jersey law to have a deadline of 10 years for replacing lead service lines. A link to that law is here in the slide. We want other states to follow that. We've got to get these toxic pipes out. There's now unprecedented federal money to help do that. It's just got to get done. The other key thing is that if we're going to replace faucets, fountains, plumbing, fixtures in our schools, we want to replace them with new stuff that is not going to leach lead. And unfortunately, even under the current federal standard of so-called lead-free, even that current federal standard of lead-free plumbing, there have been lab tests that have found a number of faucets and other fixtures to still leach some lead. That's why we worked with many other allies in California to pass AB 100, a new law that sets a much more stringent standard for the fixtures themselves, limiting the amount of lead allowable in faucets and other so-called endpoint devices, so that at least those we know are not going to leach lead beyond 1 part per billion. That Q equal or less than 1 standard is a shorthand for it's not going to leach more lead than 1 part per billion, and that's much better than the federal so-called lead-free standard. The other place we're seeing a lot of progress is at the local level, where community grassroots activists have demanded that their school districts take action, or those school officials have proactively reached out and said, we want to take this problem on and really ensure safe water for our kids. So there's a write-up of each of these places: Detroit, Philadelphia, San Diego, Portland, Oregon, and Brockton, Massachusetts. There are many other school districts that have also taken important steps in the right direction. These are just a few of the ones that we highlighted in our report that are really taking that preventative approach, not just testing and fixing the taps where lead is found, but wholesale going through and ensuring safe drinking water at all the taps. That's what these school districts are doing. Let's go to the next slide. So what does that all mean for our work? I know we're going to talk about this in the panel in a little bit, but I just want to underscore what an incredible opportunity we have to make more progress at the state and local level wherever you are. You should know that your school district is receiving unprecedented federal funding right now through the American Rescue Plan, something called ESSER, the Elementary Secondary School Emergency Relief Fund. Now, that money, a lot of that money is going to go to other things like lost learning due to COVID and HVAC systems and whatever. But we've calculated that it would take a tiny fraction of that funding to ensure water bottle stations with filters for every K through 12 student in America. So just that one step is totally within reach with ARPA funding. There's other state and local American Rescue Plan funding. There's an EPA grant program for lead reduction, state funding, the bipartisan infrastructure bill. Money should not be the reason we can't get the job done and get the lead out. And finally, also, we looked in our report at places where there are bills pending that could really get much stronger. So in Massachusetts and Michigan, here are 2 states with pretty poor grades. Michigan still getting a failing grade in our report. Massachusetts barely squeaking by with a C-. And yet here are these 2 new bills that could vault Massachusetts and Michigan to the head of the class with really prevention-oriented approaches. So if you're in the Bay State here with me, or if you are in the Great Lakes State in Michigan, let's see about getting these bills passed. They really could ensure much safer water for kids. And then the last slide is just my contact information and link to our toolkit as well as our map. Those are 2 other features along with our report that we released. Delighted to be here, and hopefully we can all roll up our sleeves and take more action to ensure safe drinking water for kids.
All right, that was amazing. Thank you so much for providing such a robust overview of the report. I know it's a lot to look at. So even with the presentation that John gave us today and this deep dive, I still would very much so recommend that when you have leisure time, even if that's a thing, to delve a little bit deeper, especially as it relates being able to go state to state. I just know as an organization who was founded on the grounds of lead exposure, just really excited about the intentionality and the time and dedication it went into drafting this report. So I do want to acknowledge if there are any questions that any of our attendees may have. Feel free to use the Q&A box feature, or if you're unable to do so, you can also drop any of those questions into the chat box as well. And we're going to get Insight back up here. Well, I do have a question, so I'll go out of turn. That is for John. So through this process, can you kind of talk about what it was like engaging with so many different people? So we're talking about doing a deep dive on the 50 states. So what was that experience like, and what were some interesting things that you encountered with speaking to? I mean, I can't even imagine how many different people to get this report to come to life.
Yeah. Well, I would say, some of it was just, boring legal research. I had a team of law students working with me to look up the statutes and regulations and make sure that we had all the citations and that sort of thing. But I would say the much more rewarding and insightful part of the research was talking with grassroots activists, folks that were engaged with the ordinance in Washington, D.C., folks that are working on the filter first bills in Michigan. We worked with legislators on many of these policies in places like Colorado, Missouri, Washington, that are graded in our report. So we knew firsthand from our state affiliates the legislators, the communities impacted. So that was really the most rewarding part of the research.
Awesome. And again, listen, it was helpful to us, right? So just in the spirit of transparency with Black Millennials for Flint, the work that happened around the DC bill, we were very instrumental in being able to bring community into that conversation with the establishment and development of that bill. So we know how taxing that is with time. So really excited that, this is a resource that can be used for a myriad of different ways. So we do have some questions that have come through our Q&A box. Shout out to Miss Kathy Temple coming out of Memphis. Her question is, what steps are being taken in Memphis or just in the state of Tennessee to get more close to a B+, like we see in places like the District of Columbia? I could particularly speak to that, but John, did you have any insight there? I'm happy to take that.
I think I'm gonna hand that over to you. We're happy to help, but you're obviously the person who knows the most.
Yeah, so to answer that question, so one, I would be remiss not to even applaud first that Tennessee even has a stake in this game. Tennessee is not always thought to be very progressive, but shout out to former state senator who is now the mayor of Shelby County in Memphis, Lee Harris, that introduced and got that bill passed. So some steps being taken from a state perspective in the state of Tennessee. Former representative, but now Senator London Lamar did introduce an amendment to the current bill, which actually looked to bring that level of remediation lower. So right now, it does use that 15 parts per billion threshold that John spoke about a bit earlier, but we know we want to get as close to 1 part per billion as possible. Unfortunately, right in the midst of when at that time Representative Lamar introduced that bill, COVID hit. So a lot of priorities as it relates to legislative priorities in the beginning of COVID, especially in the height of it of 2020, priorities shifted. Also, just, being quite frank, one of the biggest challenges, because remember this with the timeline, this bill went into action or was enacted in 2019. The bill was unfunded. So that also was a bit of pushback from a local perspective at the time that the bill actually went into effect, is because there was no funding that was allocated to do this testing. And so the brunt of all of that financially was by individual districts. But there's an angle of hope here. So going back to what John shared earlier, money is not the issue anymore, right? So there are opportunities both from a federal level. The money is trickling down, from state to local to do some investments. Now, one thing, and I'll stop here. One thing that happened once children began to return back to schools in Shelby County, which is Memphis in particular, Shelby County's school board did invest a significant amount in a water filtration system, where one of the concerns was, and not just specific to Memphis, is a ton of water bottles. So even beyond some fountains in some schools being turned off because they were cited as having elevated lead levels, you couldn't use a common drinking water source because of COVID precautions. So it kind of addressed both things at the same time, but there's some challenges that existed with that as well. But there's some things that are happening. We hope that once we get more updates from EPA around the revisions to the lead and copper rules, specifically for the state of Tennessee, that will give us more leeway to lessen that threshold where they can get closer to being as robust as we see the bill exist in DC. But I'll stop there. We do have another question. So the question is, do you know if the bipartisan infrastructure law set aside funds that can be used for filters and faucet replacements? So
the answer is yes. There are two sets of money in the bipartisan infrastructure law related to lead and drinking water. Well, three really, but two specifically. One is the one that's more well known. That's the $15 billion with a B for removing lead service lines. But separately, we worked with legislators to also include a $200 million package just specifically for schools. Now, that school program at EPA, it's a grant program, so school districts apply to EPA for those grants. It used to be that those grants could only be used for lead testing. But we said to Congress, look, let's not fiddle around with more testing. We already know the water's contaminated. So let's give schools the ability to use that money for lead reduction as well. And now that $200 million grant program from EPA in the bipartisan infrastructure bill can be used for lead reduction.
Yeah, and I want to add another part to that too. That also does not exclude, but includes childcare facilities as well, depending on where you live. So I know I can speak specifically to the state of Tennessee. There was a little shy of $1 million that was invested specifically for childcare facilities, and that would be your traditional daycares, home-based facilities as well, that had access to get free testing done. So things such as the bipartisan infrastructure law, ARPA, as John mentioned, has really created this financial foundation where it's not necessarily like I can't do it anymore because I don't have the funding. Now we're looking at, are you willing to do it since those resources have become available? We have another question that is actually directed to John. So the question is, are you willing to work with grassroots groups to strategize and implement a plan to gain access to lead-free water for kids in their locality and state?
Absolutely. If I can, let me just share one story. I put Philadelphia on my screen as one of the places we're seeing progress. That's not because the Philadelphia School Board was enlightened and willing to do the right thing on their own. It's because our state affiliate, Penn Environment, partnered together with the Black Church Center for Justice and Equality. And working with the Black Church Center and Penn Environment, we mobilized our grassroots activists in Philadelphia. We got huge media attention in analyzing the local test results, put out a report. And when the school district failed to do anything, we and the Black Church Center together went to City Council and got a counselor to introduce an ordinance requiring the school district to install water bottle stations with filters throughout the schools. So, and then there are other places we've worked collaboratively with school districts that want to do the right thing. So local activists worked with us in San Diego, where the school district said, hey, we want to do the right thing, but we don't even know what that is. Can you help us? And we came in and provided some technical assistance and worked together on a policy that's now one of the best in the country. So absolutely, whatever your situation is, we want to help local grassroots activists in their struggles to ensure safer drinking water.
Thank you, John. And I just volunteered you again. You're make sure that all your information is shared with guests that join us this afternoon. I mean, also thank you, Richard Diaz, for that question. I can attest to John and Environment America working with the grassroots organization. Again, we do not have capacity to do a report, even in that regard, like he did, that's so robust. So I can attest to John in particular being very much so willing and engaged with grassroots on the ground organizations. We have another question, and this is specific to California as it relates to AB 249 and EPA's lead and copper rule revisions. So this is some context. It says their water utilities are arguing that they should wait for federal action. Yep, sounds familiar. Before introducing a testing or remediation mandate. And the question is, do you all expect a stricter standard than 15 parts per billion? And would California be able to get a lead and copper rule waiver if they took action sooner? It's a really good question.
Wow. Let me try to, this is a complicated question. I want to make sure that our other panelists get a chance to talk, but let me try to answer this as efficiently as I can. I think this is a red herring, in my opinion. We've been waiting for EPA to update the lead and copper rule for years and years now. We don't know how good it's going to be. As I said at the outset in my remarks, the lead and copper rule only applies to about 10% of schools that are federally regulated as their own water utilities. So the notion that California or any other state should wait is ridiculous, because even when that rule comes out, it's not going to apply to the 90% of schools that are not regulated as water utilities. So no, I do hope that we get a stronger limit in the lead and copper rule federally for reasons beyond just schools. It has to do with the health of our water, but more importantly than a lower limit is, I think what we need EPA to do in the lead and copper rule is what New Jersey has done, which is order water utilities to replace all of these lead service lines within 10 years. That kind of proactive, preventative policy is what we need to see in the lead and copper rule.
Yeah, I don't know if, yeah, I'm sorry, go ahead, John.
No, I was just going to say, I see there's one more question here about studies on attention span and antisocial behaviors. We reference some of the medical literature in our report, but really the best place to go is the American Academy of Pediatrics 2016 report on childhood lead toxicity. There's a link to that AAP report in our report. And I bet NSAE has a dozen other scientific studies that she could rattle off much more quickly than me.
Yeah, we can be sure to share these links as well when we do a post engagement after today's virtual event. But thank you for addressing that question. Some other kind of follow-ups to that before we transition into the panel component. So this is a question that was very specific to Memphis. There's also a wealth of knowledge particularly around testing. Now, it's not recent, so a lot of testing happened in the early 90s. If you visit the Memphis-Shelby County Lead Safe Collaborative website, and I'll make sure that that's shared in the post-event, they have quite a bit of information from a historical perspective that kind of speaks directly to lead as it relates to Memphis in particular. So I'll make sure to share that. All right. So that was such a robust Q&A. Those were some excellent questions. I'm really fired up to transition into this next component of our time here together. So I told y'all that I had some experts in the house, the virtual house this afternoon. So we heard quite a bit from John, but it is now my esteemed honor to start this conversation about what's next. So we talked about this is the lay of the land right now as it relates to lead in school drinking water across the country. And so we want to be able to use that information for good. So what's the next steps? What can we start on leaving this space today? So I'm going to allow some time for some of our other panelists, since John had an opportunity to introduce himself earlier. If we can go ahead and just begin with self-introductions with Insay, and then we will turn to Michael Porcello, who will do a self-introduction as well. So Insay, take it away.
Thank you so much, LaTricea. It's always an honor to work with you. John, thank you so much, you and your team, for this incredible work. We need to be doing all that we can for our children of today and our next generations. And I will just say, this is one of the biggest children's environmental health issues that we have had in our history. We've known for over a century of the major routes of exposure of concern for children. So, we really do need to get our act together, and this is preventable. I'm Insay Oba-Witherspoon. I'm the executive director of the Children's Environmental Health Network. We're a national nonprofit based in Washington, D.C., also providing international technical advisement as well. And lead prevention, again, has been a core of our work since the beginning of over 30 years of our nonprofit mission, and ensuring that all children, especially our most marginalized, which lead poisoning tends to also target, are given a fair shot out at this life, understanding there are many other challenges to their well-being and nurturing of their spirits and their abilities to attain the highest educational abilities possible, which again, lead exposures do cause a major challenge too. So it's an honor to be here.
And hi, everyone. I'm Mike Porcello. I was, until last December, I was the committee director at the Council of the District of Columbia for the Committee on Transportation and the Environment. That committee had oversight of our water utility and an agency called the Department of Energy and Environment, which is responsible for I don't want to say all of our environmental hazard work and abatement, because we have a Department of Buildings, which does more generalized inspections, but is, I would say, responsible for our more pointed and policy focused work in that front, whether we're talking about lead paint, lead in water, mold abatement, and broader environmental hazards such as air quality and it's like heat islands, other things that can be almost more attributed also to climate change at this point, which is part of their mandate. I was chair of the committee when I worked on the committee when we moved forward the Childhood Lead Exposure Amendment Act of 2018. I have since worked closely with Black Millennials for Flint and other organizations to expand on that bill and enhance it, and also work on lead abatement more generally in terms of lead water service line removals throughout the district, and addressing the health impacts of lead in both young folks and throughout the community. So happy to be here today, and thank you for having me.
Yeah, awesome. Like I said earlier, I always like to give credit where credit is due. So I can also attest that Michael has been very much so helpful from a community perspective, which is not always the case in some of the places where we may live, but can definitely attest to Michael being so encouraging and thoughtful and thorough as it relates to some of the work around the bill and implementation in DC. So we're going to go ahead and get into the conversation. So we're going to follow back up with John. We're going to get him back on the camera here just shortly. So actually, I want to start with NSAE. So NSAE, we heard from John today, and there's a lot of states that, are kind of doing the bare minimum. Some are doing, not all states are created equal right now as it relates to standards and testing in school drinking water, but particularly as it relates to childcare facilities. So I know it was mentioned earlier today, there is no safe level of lead for any human being. But particularly for small children, infants, they're the most at risk as they're in their introductory stages, their development stages. So, NSAE, can you talk to us a bit more about what are some ways that existing policies, laws, standards can be improved to be more inclusive of children, so childcare facilities, so not just starting like K through 12, like when children are traditional school-age children, but from the onset, what can be some things that stakeholders and other policymakers should be taking into consideration?
Thank you so much. Yeah, I mean, this is so real. In the United States, a child can enter early learning childcare, licensed or unlicensed, anywhere from 6 weeks up of age. Your brain is still developing when you are born into your toddler years, your respiratory system, all of this. So all of that places you in harm's way as a little child just trying to make your way in this world. So it really does call upon us to look at the places where children spend the majority of their time and making sure that those environments are conducive and healthy. And so K through 12 schools, important. Homes, of course, important. Grandma's house, many other building structures, very important, but we cannot be remiss on the earliest of the cognitive learning stages of a child. And that we know that the vast majority of children up to age 5 in the United States are spending some portion of their early childhood in a childcare facility. So number one, whether it's childcare, schools, homes, what have you, we strongly advocate you have to put the needs and the well-being of children first. So we have a Children's Environmental Health Indicators report, for example, that would help federal agencies, state agencies, and other advocate groups offer up those type of indicators that to know that we're doing this in the most protective way. When we're putting forth bills, when we're thinking about standards, if children are not even at the table as far as on the agenda, odds are their specific needs are going to be lost. So that's the first thing. And I just want to mention that the Government Accountability Office at the federal level looked at childcare facilities in 2020 and recommended that federal agencies need to enhance monitoring and collaboration to help assure that drinking water is safe from lead. So the Department of Health and Human Services, the HHS Office of Child Care, provides states with resources and technical assistance to help determine if drinking water in childcare facilities is actually safe from lead. However, that office does not require that drinking water is tested because there is no requirement to do so under the Office of Child Care's Administrative Child Care and Development Block Grant. So a lot of the times the funding connection is very important here. So that's a key federal funding source for states that are used to subsidize childcare. So either way, though, some states, as we've been hearing, do require also childcare providers to test the lead for drinking water, but it's not consistent, it's not standardized. Childcare licensing happens differently at all state levels. So that's also a challenge here that we need to overcome when it comes to the protection of children. And the Office of Head Start is also important here at the Health and Human Services Division because the Early Head Start program at times is also servicing some of our most marginalized, high-risk populations. So it's a win-win here when we talk about public health outcomes. So they have performance standards that require grantees to provide safe drinking water to children, but they do not ensure that grantees comply with them. So for example, they do not require grantees to test their water or document that it is safe from lead or safer from lead. And they don't check grantees' compliance with this standard during their monitoring reviews. So definitely that would be a huge step forward to look at these buckets of programs, federally funded programs that are showing up in our early learning spaces that already have other safety and health requirements, but are not necessarily right now encouraging public health, environmental health standards and indicators like lead prevention. So the recommendations that I think we also agree that come out of their reporting and looking into this matter is that the Office of Head Start should continue to refine its monitoring protocols after it's updated its monitoring training and to start collecting information, right? So not much of this has been happening. Much more has been happening at the K through 12 school level, which is great. We're missing out on the same level of monitoring and tracking so that we can identify these gaps of coverage and address them quickly. Also, the Assistant Secretary for the Administration of Children and Families could direct the Office of Child Care to develop an agreement with the EPA on their roles and responsibilities in implementing a memorandum of understanding on reducing lead levels in drinking water in schools and childcare facilities. So these agreements could also include ways in which the guidance and information could be shared with states and Head Start grantees, and through webinars, email, and other forms of education and training, which would be essential. Also, the Assistant Administrator of the Office of Water could develop at the EPA an agreement with the Office of Child Care at Health and Human Services and Head Start on their roles and responsibilities in implementing a memorandum of understanding on reducing lead levels. And the Assistant Administrator of the Office of Water could direct the Office of Water at EPA to specifically work on tracking the progress towards the outcomes of this memorandum of understanding. So there is an executive order on children's environmental health that has been established since the Clinton-Gore administration. This work falls very naturally under that executive order, where the Office of Child Health Protection at the EPA is given this very large responsibility to try to ensure that the federal government agencies are putting children first in the work that they're doing. I think we can all attest this is not still happening, and this is a prime example of how we can get it much better for children who are not even born yet, who no doubt will spend a lot of time in these facilities.
Yeah, and that was thank you for that insight. And that was really a powerful point at the very end as well, is that when we think about children, we have to think about children from the whole span of life, right? So also it's really important to take into consideration the implications for childbirthing people. So, I mean, if I am carrying a child, also, even beyond my own health, with a growing child, fetus, you also have to take into consideration what that exposure in utero, what that looks like, even postpartum, and the implications that lead exposure may have between breastfeeding, for example, in children. But I know that's a whole nother conversation. But thank you so much for sharing these opportunities, again, to be more inclusive and thoughtful about the full reign that is childhood. So we're going to shift back up to John. So again, John, you told us a lot today during your briefing, but one of the things that really resonated with me is some of the work that's being done, like even at a local level, where maybe the state is not where they really need to be with making the type of legislative actions that will really get us towards lead-free schools. But would love to hear a bit more insight around some pretty promising pending local legislation or from the state level as it relates to testing for lead in school drinking water. Sure.
Before I do, let me just say, I just want to echo what Nsé was saying about childcare. And ensuring, that is fantastic work that Children's Environmental Health Network is doing. The youngest kids are the most vulnerable to lead. So that is just really, really important, those initiatives with the administration and elsewhere. At the local level, we put together a toolkit to help parents and other activists tell their school districts, hey, here's what you can do on your own. You don't have to wait for the legislature to act. So it goes through the problem, it goes through the best solutions, it goes through the funding sources and some sample activist steps like a petition and so forth, other tools. So if you are a parent or other activist in your community and you don't want to wait for your state legislature to act, you just want to get your school board to do the right thing now, our toolkit maybe can help with that. There are two places we are hoping to see progress this year at the state level, as I mentioned, Michigan and Massachusetts. Both of those bills take slightly different steps, but they are both in general along the continuum of preventing lead contamination at every tap rather than just fixing specific faucets or fountains where lead is confirmed. So those are, and that's very similar to what DC has. The Massachusetts law would set a 1 part per billion standard, so that's great. The Michigan law would require filters at every tap for both. There's one bill that's for schools. There's another one for childcare, slightly different provisions, but both taking this preventative approach. So I can go into more details, but those are two states. And then I also want to give a shout out to Lead-Free Delaware. The activists there in Delaware have been pushing, and this might be the year that they finally start to get some tractions and answers. The state kind of botched an EPA-funded testing program and was forced to publicly admit at a hearing that they had messed the thing up and needed to do better. So activists at Lead-Free Delaware are taking advantage of that moment and educating legislators, and maybe we'll even see some better policy in one of our smaller states by the end of the year.
Yeah, and I'm not sure if any, and this kind of is going to go into some things when we talk to Michael, but one thing that I'd like to really uplift is this can very much so be something that's hyper local. I think, I'm going to use DC as an example just from personal experience. Now, DC is different because it's not a state, so it does operate a bit differently, but it still was very much so local. I mean, you had parents that were in elementary schools that, it started with there being discolored water and it kind of expanded from there, right? So it was very much so a response from community to push forward for something that didn't necessarily have having to wait for things from the federal level, having to wait, for things that literally may take an act of Congress, literally. So it can be something that can happen at a very local level. So for example, even from a school board level perspective, there's power and influence to be able to address these issues. Uplifting again, Shelby County or Memphis Shelby County schools in Tennessee, them not waiting for someone to say, hey, you can use this money to put in water filtration systems, but knowing hey, we know that we're having issues with lead in school drinking water. Let's be as proactive as possible, autonomous within our own right to address those issues. So hopefully that can inspire some folks that may not necessarily, where they may have a state that's in the gray, that's on the not doing so great list, but there's still opportunities to grow and to work from a grassroots and local level. So just wanted to lift that up. So we're going to shift to Michael. Hey, Michael. So we've heard quite a bit today where based on this report, that DC is kind of leading the charge. But by all means, it's not perfect, but definitely does point out some really strong points that we hope will be a model in those places that are really looking to get to a good point around testing. So one of the things that I thought would be really interesting from your perspective, and it's really interesting about this DC bill, and the DC bill, it explicitly names what entities are responsible for what. That hardly ever happens. Man, life would be so much easier. And the grand scheme of things, if it was very explicit about who does what. So it won't be the Spider-Man meme where it's pointing to you, you do it, you're supposed to do it. It's very clear around what people's roles and responsibilities are. But even with that, we can have the most pristine policies, standards or what have you, but implementation sometimes can be a bit challenging. So from your perspective, Michael, can you kind of talk about what has been some of the victories of course, with the DC bill in general, and then like some challenges that you've seen and kind of overcome since this bill has been around now almost 6 years. I don't know how that's possible because I'm still 25 years old, but yeah, just really curious to hear some of your thoughts and experience thus far with the implementation of a lead bill like this.
Sure, and thank you. Just to give folks backgrounds, as you touched on, this bill was passed in 2018. I would say on the front end, the biggest victory is that we identified the problem, we identified a solution, and we funded the solution and we implemented it. So often we will get sort of 2/3 of the way, we will find, we'll get a good plan and then we'll find out that it's going to be expensive and all of a sudden we back away. And the district really put its money where its mouth was, or backed itself up. And the bill, it was not cheap, at least for our budget. The total cost of the bill was $19 million. That took, that came from local money. That wasn't at the time, I think, any federal money, or not a huge chunk. And the victory has been, I go every year on school tours and I see them at work. I see the stickers on the various sinks. We actually go through and check to make sure that every sink has a sticker on it, either saying, a barcode showing what you can scan to go to the tests, or a sign that says, this isn't a drinking water source. That is, one of the, I don't want to call it difficulties, but things that folks have to plan in doing this work at schools is there are many different water sources in schools and they're used in different ways. One of the interesting things that we faced was it's called the Department of General Services, the agency that does basically building maintenance and management for the schools, ended up going to Europe to figure out the best way at the time to find filters for sinks in classrooms that had hot and cold water, because they discovered the hot water was destroying the filters within a short period of time. And I'm raising that, it's a very micro level issue. I'm raising that in case there's folks from other jurisdictions here, because the district would be happy to share that information and what it discovered, because we actually have had a very successful faucet filter program because of that work they did. The difficulties, I think, with any bill like this, I always say that, the legislative process is, a sledgehammer when a scalpel is needed. I love that we prescribed everything in that bill, because it means, one, that we hammered out exactly how this was going to be done. We didn't go, hey, we need to get the, lead out of water in schools, and we're going to give the executive a year to figure out a plan and execute. We sat down and figured out every step. The flip side to that is, that can remove flexibility. As we worked with LaTricea on an issue related to access to data, one of the big parts of this bill too is it includes child development facilities and provides free testing and filtration methods, whether it's providing jug water or on-site filters to child development facilities. Attached to that was data collection, so we could understand what the test results were, how quickly remediation was happening, if the law was being followed. And, Black Millennials for Flint brought to us the fact that the report had not come out from the agency that was overseeing that. So we passed a bill last year to update, have a different agency promulgate those reports, have them doing it in real time, so we could see how that was working in those facilities and making sure that work was being done. So sorry, just to say, one of the issues is always providing that flexibility. We had a 5 part per billion standard we adopted in our law, which at the time was, I think, as robust as it was going to get. We had a very long discussion about whether it should be 5. Some folks were suggesting 3.5. We had discussions at that time about what the testing could reliably show and what the district was comfortable with to make sure we weren't getting false negatives or anything like that, and settled on 5. Another thing I noticed, we had concerns that if we were providing, and this may not be the case anymore, but at the time, if we were providing bottled water, that was at a 5 part per billion standard. And we weren't sure, about the consistency of shutting off a sink and then providing, water we had deemed was unsafe to students. But we continue to want to strengthen that. And one of the things we did in our law, or at least the agency has told us, is that they are able to enhance that standard by regulation. We've been talking to our Department of Energy and Environment about what it will take to enhance that. Actually, in that bill that we moved last year, considered statutorily doing that. And they said, no, we don't want anything in statute that'll make it even harder to change. We're going to do this. We're going to enhance it via regulation. So that's something to consider as well. And I'd say the other, big piece is getting good data. We need to know that the program's working as it's intended. I think it's not just about researchers, it's about families having that data. When we were talking about this child development facility bill, of course it is important to know that the program is working, but it's also important to families, if they're choosing where they're going to enroll, to know that the drinking water is safe and be able to go to an easy, accessible website or other portal to understand what that risk will be, or at least have the opportunity to do so. Same with our public schools. I also say we included our parks and rec facilities. And I should say it's both our traditional public schools and our charter schools. So data is particularly key. If some folks may work in a jurisdiction where it would be more difficult to prescribe something so explicitly, I think a lot of the hiccups are avoided if you do that legwork on the front end to make sure the executive, the implementing agency, and the legislature are on the same page. I think this is the kind of thing that if you're going to have to drag the executive there, it's not going to be done well. And you really need to, I don't want to say delay at all, but you need to really, as a legislature or as advocates, get the executive on page to make sure that they're doing this right. They're dedicated to the testing, they're dedicated to the remediation and to the data production. Some of that is making, messaging that it's not a gotcha, that it is just about doing this right. We were very clear with the executive that we're here to be partners. We're not looking to get this data to come back and go, you're doing this wrong. We're getting it so that we can go, this is safe. And, issues have come up where we found out that testing isn't where, maybe the testing was missed at a school rarely, or maybe remediation wasn't happening as quickly as, a school community, or it should have been, or a school community was comfortable with. And we addressed that. But, the goal is to get those partnerships so that everyone is working towards the same goal. I could say more, but I will move on so we can talk about other items.
No, Michael, that was so good. And I really appreciate all these different perspectives, right? Because it's one thing to get a bill passed. And I think a lot of times, and even I have to check myself in policy work, where it's like, that's the first check off the box, like, whew, this is the first hurdle. The next part is like, can we actually do it? And are we doing it well with fidelity? So that is important to add some of those additional nuances, I think is very helpful to people who are looking to get towards the stronger standards from a local or a state perspective. I think that really does best inform. And even like talking about, like, when you talked about like the implications like for hot water and what implications that had like on filters, it's good to like know that information. I remember in the beginning phases in this bill around like 2016, 2017, having to actually talk to people from a technical perspective around how is this literally going to work? So I think, it is important. And I think even now, as kind of this government to community and bringing in like scientists, is more collaboration that we see and is necessary when we're trying to get to these lead-free schools. It's definitely not something that can be done successfully in isolation. But I want to get to this next question, and it's kind of for all of the panelists. And then I do want to make sure that we do have a couple of questions that came through before we wrap up. But this has come up quite a bit this afternoon. We are waiting, Lord have mercy, for these revisions to the lead and copper rule. Shout out again, I forgot who it was that joined us that mentioned, I think from California, like, are we going to have to wait, for these revisions to come out before we can really strive towards having more rigid and stringent standards, laws, or what have you? I know we came across that hurdle too in the state of Tennessee, where they're like, hey, we want to see what comes out, from EPA, which is from a grassroots and activism perspective. We don't want to hear that. We don't want to hear. We want to know like what can happen now. So kind of just pushing it back to you all, what would be some advice that you would give to people who are in these positions of political power and influence around like, don't wait, like act now if you can. And we can start with Insay and kind of circle around hearing thoughts from each of the panelists.
Yeah, I mean, this again, I get on my soapbox around this whole lead issue in particular, because unlike some of the other exposure pathways that we so much spend our time on, this is 100% preventable. Now, I'm not saying it's easy. I'm not saying it doesn't cost. I'm not saying it might even disrupt a bit of people's lives or lawns or, property or what have you. These are minor inconveniences for what the outcomes are. So I would offer that while we are taking advantage of these states that are being proactive and are starting to test on a regular basis and track the data, like Washington, D.C., that can happen simultaneously while we also look at the lived experiences of the numbers of children and pregnant moms, I would add, who are exposed on a daily basis in this country. Like John said, 9 times out of 10, the tests are going to come back with some form of contamination. And there's other forms of contamination in our water, by the way. Lead is one of these that we're concerned about as a neurotoxicant, adjusting the brain. So I'm very focused on letting folks know that we have to be proactive. There's primary prevention, which is avoiding the exposure in the first place. There's secondary prevention, which tends to fall in this bracket of lead prevention, where we're screening or we're testing, and then we're identifying a concern and then retroactively trying to figure that out. That whole game of Russian roulette needs to be thrown out the window. That is not the way that other countries handle this in some regards. It's not the way that we know public health needs to handle this. And at the end of the day, my kids say, when you know better, you must do better, right? That's what the kids are saying these days. It's a pretty logical approach. So just like other things that we care about, we have to get serious about the technical advisement that is needed, right? I think we all understand, even with money, these schools, childcare facilities for sure need a bit of assistance here to navigate these systems, to have these relationships with their water municipalities. So it's more seamless than an additional thing to do. Even when they're bought in, they still need assistance, right? So our eco-healthy childcare program is one of the ones there, steady, ready to lend that assistance with them. We just got to understand that money and capacity is needed. Yes, we have some case examples where the monetary amount has been determined, the goals are being set, and there are strategies to meeting those goals monetary wise and as far as a timeline wise. Every single state needs to have a very clear lead prevention strategy. Start with childhood, because that's a natural benefit for everyone. Those are some of the basic high level recommendations that I would make for this and lead from paint exposure and any other major exposure pathways. But let's get the major ones out of the way, like through our water and paint and other sourcing.
Yes, I knew you were going to come through with some gems. John, you had some things to share as well there.
Sure. Yeah, I would just reiterate, again, the lead and copper rule governs water utilities. It does not govern schools or childcare centers unless they happen to be water utilities, which most of them are not. So the first thing is, it's just a total red herring. The lead and copper rule just is not going to set enforceable standards for most schools and childcare centers. Got to take action at the local level. Second thing is, we all know that federal bureaucracy takes forever. So even if EPA does finalize the lead and copper rule by the end of this year, it's going to take another couple of years to, roll it out and all the rest. And meanwhile, our kids are stuck drinking water at risk of lead contamination. Again, school districts should be acting faster to ensure safe water for kids. And then the last thing I'd say, less of a legal argument or a factual one and more of a rhetorical one, like states like Alabama and Idaho, and I don't know, pick whatever state you want, that always hate it when the federal government tells us what to do and how to do it. And now you're going to use the lead and copper rule as an excuse not to take action? Really? Really, Tennessee legislature? Don't you want to be setting the standard to ensure kids' health, not letting those federal bureaucrats in Washington, D.C., why are you leaving it to them? So throw that right back. State and local action can be more nimble, kind of to paraphrase a point that Michael was making. It can be faster. And I'm almost certain that even if we see improvements in the lead and copper rule, they will not be as strong as what DC has already done, or the even stronger proposals we're seeing in Michigan and Massachusetts this year. So There is no reason to wait. Our kids' health depends on action now. School districts, cities, states can act now, and they should.
Yeah, and I would just add to that, to sort of touch on what John just said. You have all the expertise that you need now to act. There is nothing that the federal government has in its back pocket that is, gonna, in these new rules or whatever guidance they put out, that's gonna shake up what we know now about lead. We know that there's no safe level of lead exposure. And, even if they came out with, your jurisdiction needs to decide what it thinks is the appropriate level of lead exposure in drinking water and take action as soon as possible, because it's going to take time to stand up. It's going to take time to find the funding, and it's going to take time to do that work. In DC, we chose 5. And I'll be honest, we may have discussed 15 parts per billion, but we knew that, the study showed that that was not the right level. And we were really focused on how can we get as close to 0 with the tests and the technology available. And I think that's the conversation that jurisdictions should be having internally, is how can we do that with the funding we have, with the, what's the word I want to use, with the mandate we have from all of our agencies and the public to get this done, and prioritize it. Any waiting is, waiting for information that you already have. So begin the work now. It will take time to stand up. It will take budget cycles to fund. And you need to make sure that it's implemented right. And every day that you wait is another day that children throughout your school system are getting exposed, potentially, if there is lead in the water, to that lead. And those are lifelong, going to be lifelong. So.
John, you had your hand.
Yeah, I was just going to say that, Michael, hindsight is 20/20, of course, and you were working with the information you had at the time. But subsequent to the DC ordinance, in San Diego, they've adopted an enforceable 1 part per billion standard. In Portland, Oregon, they've used filters. They're consistently finding that they're getting down below 1 part per billion. Detroit is seeing similar things. So I'm hopeful that we can have more and more school districts adopt that American Academy of Pediatrics standard as we move forward.
Agreed. So we're getting close to time. And before we get to the final wrap-up question for this panel, I did want to acknowledge a question that came from one of the attendees that is actually is addressed for anyone to answer. But essentially, with some context, it says most often when an elevated blood lead level, which is a test that would happen with children, is detected, the response exclusively provides abatement services for a child's home. But sometimes, or doesn't in many instances, does not include water. And the question is, how can EJ groups work to organize so that the lead service line replacement aspect is included within that action response? I can quickly start. I don't know if they're still in the house, but Black Millennials for Flint has worked since maybe 2017 with the Green and Healthy Homes Initiative. As well, more locally, we work with the organization that I mentioned earlier called the Memphis Shelby County Lead Safe Collaborative. And essentially what both of those adjacent programs with both of these particular groups, they actually do home inspections. So they look at the vitality and health of the whole home. So yes, they look at lead paint that may be in the home, but then they look at other aspects that makes up a happy and a healthy home. So they also look at water samples as well, particularly in Memphis, Light, Gas, and Water. They do offer free water testing kits, which is emphasized heavily, like to get that so you can know what the status of your water is. And then they even assess for mold and all the things that make up a healthy home. And so because we're able to work collectively with each other, not only are we providing that educational awareness component, but then there's these other diverse aspects to actually remedy what's going on in the home that may not necessarily just be specific to lead-based paint, because you're right, a lot of your local programs, a lot of your health departments and what have you is really connected to lead paint. But with more on the ground work of collaboration, we're able to really do the full analysis of both water, and that could be looking at like your fixtures. What is the source? Where is the lead coming from? So with those respective organizations, they're able to do just that, what this individual was kind of alluding to. But I welcome any of the panelists that have some insight on that question as well.
Yeah, thank you. I just want to say I was just on a phone call yesterday. I mean, this is how very urgent and relevant all of this still is. A pediatrician from Children's National Medical Center in Washington, D.C., one of the renowned children's medical hospitals on the East Coast. And for a year now, she has been working with Department of Health in Washington, D.C. and Maryland, because this child goes back and forth with family and many housing issues and all of that. At the end of the day, she's dealing with a patient with seriously high levels. So yes, we're talking about low dose realities, for real. And then in 2023, we are still talking about extreme cases. This is an injustice issue, it's all of that. So I would offer that, again, we have, the benefit is we don't, as has been said many times, we don't have to wait anymore for anything. No new science. Place like Washington, D.C. has ample data on how serious this is and the major routes and all of that. So faith-based groups, community-oriented groups, environmental justice groups, I would offer some of the school PTOs, PTAs groups, because our schools and our childcare and our family network structures need to be supportive of these institutions so that they can be successful, period. So I would just offer that there, and our water municipalities. So a group like the Lead Service Replacement Collaborative that some of us are on is just trying to advance the complete replacement of lead service lines. And what we're trying to do is make sure that the relationships that need to be there between the health department and the water municipalities is solid, because many times it's not. They're not even working together. So you can imagine how much of a disservice that is for community when there's an alarm like the child call I just got. So I just wanted to stress that there is a role for all of us. We do not, again, we don't have to wait, but our advocate groups, our faith-based groups, our ones in the community who have the rapport and the connection to our residents are huge here, because you can help elevate the resources and toolkits that many of us are trying to get out there, so that we don't have to wait and we don't have to receive calls with that extreme case. That child's life is now changed for the rest of their life. It's not a death sentence, but it means the education system, the social services systems, all the other systems that have to be in place, that need to be in place for that child, are now going to be, forever, and for that family unit. And it's just exhausting to get those calls time and time again.
Yeah.
I would add to what Nsé said, just touching on in DC, we are working now, the boss I work for now, the council member, we just introduced a comprehensive piece on meeting our lead service line removal plan goals by 2030. It is, I just want to highlight a couple pieces there, in that, it includes a very robust community engagement and public education scheme. I think one of the hurdles when it comes to lead in water is, some folks don't think that exposure is a risk to them. And one, it can be a risk to folks of any age, but also, we're thinking about a child who may have a test of, high lead levels. Just testing their home may not be enough. And, they might be spending every afternoon with a grandparent who has a lead line and, doesn't even think of it because they're a senior and they never thought about it. And they're not realizing that child's drinking that water. One of the key parts of the bill I just want to raise, and we're hoping to use the IIJA, the federal money for this, is on a comprehensive filtration scheme. It's going to cost a lot of money in the district to remove these lead lines, and we need to plan for it, but we need to do all we can in the interim to make sure that exposure is not is minimal, or is not existent, I was going to say, but we also have to, filters are not perfect. Folks have to use them correctly. There needs to be good education on that. And that's going to allow anyone who has a lead line or a line of unknown composition to access these filters. And we're hopeful also to provide them to any family that's engaged in SNAP, TAMP, any of our relief programs, just to make sure that we are being over-inclusive, because, Nsé, as you touched on, these are lifelong risks, and we need to make sure that we are doing everything we can literally tomorrow to mitigate the risk of exposure.
Yeah, that's so powerful to mention is both and, right? So yes, replace all the lead service lines, but there has to be something that is a preventative measure in the meantime. And then really quick, like, can't believe we're right at time, but another note around that, even when you do a lead service line replacement, it takes a while for everything to get settled. So you still have to do like routine testing after that. It's not like a silver bullet where right away everything is perfect. So that filtering component in the interim and even in like the first couple of years of replacement is really is very important to take into consideration. So I do want to be respectful of everyone's time. Let's just do just a quick, like couple of seconds, just last piece of advice for folks that attended today, folks that's in Facebook land, from each of our panelists. If we could take just about 5 seconds to say what's one piece of advice that you would leave to really get us to lead-free drinking water in our schools, both for our little babies and our big babies as well. So we can start with John and then circle through.
Yeah. Don't wait for the federal government. And don't just react to testing. Take action to prevent lead contamination at every tap. You can do it in your community. Let's get this done.
Awesome. Yeah, don't wait. Start now. I sound like a commercial. Insay, and then we'll round out with Michael.
What's nice here, if there's anything nice about it, is that we do not need to reinvent the wheel. There are an abundance of existing resources and toolkits. You're hearing about one today. Depending on wherever you are in the country, many of us can help lead you to some entity, advocate group, the Lead Service Line Replacement Collaborative, whomever, to help guide you a bit. So you don't have to do this by yourself. And please, every single one of you are in a community, even if you don't have a child or you don't have a child at a school or a childcare, I imagine you care about the children in your community. There is a way that you can also serve as a tool and a champion and a beacon of light for the current and future generations. And we would value your voice in this work as well.
Okay.
Yeah, and just to close, I'd say, you all know your jurisdictions best. I think the next step is meeting with the key, stakeholders and actors in your jurisdiction to figure out what a step-by-step process is to address this. It's easy to not act when you look at a big ticket number and a big ticket item and go, this is impossible. And coming from a jurisdiction that's done it, it just takes, sitting down and hammering out all of those details, figuring out the individual costs and figuring out a plan. But that's really in your hands. But only your jurisdiction can do that because it's going to be different from place to place.
Now, this was phenomenal. The work doesn't stop here. You heard it from some of these experts today. We'll make sure that you have contact information if this is something that you really want to push forward and make better in your own respective communities. Listen, all of this work, even the B+ that we got in DC started with community. So everyone has an expertise that they can contribute to this body of work. But thank you so much again to Environment America, the Children's Environmental Health Network, all of our panelists, and especially to you all who have attended. And make sure that you follow us on social media and all the respective organizations today. And let's stay connected so we can have an A+ in all 50 states as it relates to our getting lead out of our school drinking water. So thanks, everyone. Yay.
Thank you, LaTricea.
Thank you.